I now want to go through another hefty section of this chapter, which is the second category in this area of special education qualifications. And this has to do with kids who have health impairments, and we'll talk about what that means, and also physical disabilities that have to do with their muscularity or their bones or their spine. And so this other category is kind of like an orthopedic category of disabilities that these children have. So here I'm definitely going to ask you to stop off and on and look at video clips that I've found for you to show you what these look like, and I think that'll be helpful for us and keep it from being too boring too. So what does the category other health impairments mean? And so other health impairments would be in quotation marks. These are kids who live with chronic illness of different sorts. And there's a list on page 367 under the lowercase I. And so look at those. I don't have my book in front of me right now. In fact, let me grab my book and I'll look at it with you. So we're looking at page 367, I think I said. Yeah. Some of these you'll recognize and others of them you might not. But I'll just read this to you. It says, their impairment is due to chronic or acute health problems such as asthma, attention deficit disorder or attention deficit hyperactivity, diabetes, epilepsy, a heart condition, hemophilia, lead poisoning, leukemia, nephritis, rheumatic fever, sickle cell anemia, or Tourette's syndrome. So that's a really big category of other health impairments. And the point about these is not for you to become an expert in any one of these, although we will sort of talk about a few of them as examples. But the point of us understanding this is that there are kids in public schools who have these chronic or acute health conditions that you might not even know they have by looking at the child. So you can't really see that a child has diabetes just by looking at the child. You can't really see that a child is impaired by their asthma unless you spend time with that child. So there is this whole idea with this other health impairments category that children are sort of not always super visible in their disability. However, these kinds of illnesses, depending on how severe they are, can really disrupt a child's learning. And so, some of these are reasons that a child's out of school a lot. For example, asthma is one of those. In fact, asthma is the health impairment that keeps a child out of school more than any other health impairment for children. So these kinds of things that we're going to talk about, they reduce a child's strength. The child might have less vitality. So a child, instead of being at school for 6 or 7 hours a day, might be able to come to school, but only be able to be at school and in class for 3 hours a day. And so you can see how this would impair a child's ability to learn because they're spending less time in the classroom, and sometimes they're heavily medicated, and so their medication is going to interfere with their ability to, learn. And, I guess I'm thinking to myself, if I were a parent of one of these children, I still want my kid to be a learner. I still want my child to go to 4th grade, but I just have to accept that my child might be only able to learn what they can learn as a 4th grader. And I think that's one of the things that parents have to cope with and deal with, and teachers completely understand, really. Let's see, I think that's all I wanted to say about that. There is some discussion I want to make with you about the orthopedic impairment. And so when we say the word orthopedic, I always think of bones only, but really orthopedic as a medical term relates not just to bones, but a person's joints, their muscles that attach to those joints, and also the limbs, so our arms and legs. these are the kinds of disabilities that children are in this category are going to have. So in this category, I want you to stop and look for a moment at the lecture the link is called Cerebral Palsy, the Basics. I think it's a 3 or 4 minute, maybe 5 minute YouTube clip. Okay, so I'm assuming that you stopped and watched that. Really a great one. If I'm remembering what I posted this morning, this is the one where you see a lot of kids with cerebral palsy. And so you see a lot of jerking behavior. You see a lot of kids in, stand-up carts. You see kids in wheelchairs. You see kids who are using crutches. So you see really a nice broad spectrum of how cerebral palsy can be a mild form or a fairly severe form of itself. And I would ask you, as we think about cerebral palsy, and you've watched this little video clip, to think about having this child in your classroom as a regular classroom teacher. And also think about, maybe this is your child and you're a parent and you want your child to be in a regular classroom. And so here is a child with, quite visible impairments, but who might be kind of an average developing kid in terms of school performance. And this is an important category to think about. That's just a sample of some of the other disabilities that are listed in this category. How many children live with these kinds of conditions? This is a group where the numbers are a little bit hard to pin down. A safe estimate, the textbook is saying to us, is around 20%, which, gosh, that seems high to me. But of this category, 20% of these children seem to have these kinds of impairment numbers. I think it's very interesting that the textbook notes that children with these kinds of impairments, and I'm talking about cerebral palsy, I'm talking about neural tube disorders, I'm talking about spina bifida, gosh, let me see if I can find these other impairment names for you as we look through the text. I'm skipping over to page 373, maybe cystic fibrosis, cerebral palsy, or cerebral palsy certainly is in this category. Spina bifida, I've already said to you. Muscular dystrophy is one. Children who have spinal cord injuries from maybe a car accident or a sports accident could be in this category. But having said all of those names of these health impairments, in 1960, 1.8% of children overall had these health impairments. In 2004, 7% of children have these health impairments. And remember, I'm saying spina bifida, spinal cord injuries, cerebral palsy, whatever other ones I mentioned to you. I just find that interesting that these particular health impairments have changed in the upward motion since 1960. I don't know why that is. It's something that I would want to read more about if I had time to do that. We'll look at some of these specific health impairments now. I'm not just talking about the orthopedic ones that we just had a little conversation about. Here I want to go back to the other health impairments category, and the first one that I want us to look at is epilepsy. And so this is described to you on page 368. There are different forms of epilepsy. You probably know this. When I was a college girl learning this, we used to talk about petit mal, which is in French means small bad seizures, and grand mal or grand mal, which is large bad seizures. But now they've changed the names of those since I was an undergraduate student. I want you to stop and view 2 videos. One of those is a video that is called an absence or a focal seizure. And here you'll see a child who looks like she's in junior high. And then I want you to look at the next one, which is called a tonic-clonic seizure. And this is the more, jerking, visible, shaking seizure. Also, this girl looks like she's in maybe junior high too. So stop and look at those. All right, I'm assuming that you did look at those 2 clips. I was happy to have found those because they're not just a 3rd grader or a 1st grader or kindergartner. These are children who are more in the middle grades. And so during a seizure, a lot of things happen, but it's basically a dysfunction of the brain's electrochemical system. And this causes a temporary loss of muscle control, certainly for the tonic-clonic type of seizures. There is quite a disruption in muscular control. And then for the focal or absence type of seizure, you really just see a child kind of zone out for a while, but they're definitely not learning as they're having that seizure, that absence type of seizure. So these seizures do usually begin in childhood. I've had some friends actually who have had babies, infants, that they noticed were having these small absent seizures. And when they go in, take their child in to be evaluated and tested, it's determined that this baby is having these seizures like 100 times a day. Well, you can only imagine how disruptive this kind of a seizure would be for a child in terms of learning. Even an infant is, when you think about all the things that an infant brain is taking in as it begins to formulate and lay down neural paths for things like music and color and light and voice and sound and everything, touch, learning to ambulate. All of those things are really disrupted when an infant has these absent seizures many, many, many times a day or many times an hour. And so another thing I think that we need to be sensitive to is that children who have these tonic-clonic seizures, the more visible, very disruptive physical seizures, they sometimes lose bladder and bowel control. And this, I have just compassion for a child who's in a classroom in school and they have a seizure and then they wet their pants or they foul their pants, with a bowel movement. I mean, how awful is that for a child? And this is just one example of how tough these kids have to be in their classrooms and at school and among their peers. So I have some descriptive information in my notes about the different forms of seizures or the effects of these forms of seizures. So muscles can become very stiff, the child's body can get very rigid. Sometimes there's an aura that a child will start to learn to catch that they're going to have a seizure just before they have it. I sometimes wonder if this is like the aura that you get when you suffer from migraines. When I used to get migraines, there was this kind of vision that would come to me that I would think to myself, I've got to get home because I'm going to have a migraine in a very short time. So sometimes a child can get where they understand that a seizure is going to occur, but often there's little or no warning for the fact that the seizure is going to happen. Children are often very drowsy after they have these seizures, and so they may need to just lay still. And it seems to me in one of the clips that I have selected for you that you see the child actually gets very, almost looks like they're going to sleep. And these things happen generally more during the day than they do at night. And so sadly, a child with a seizure disorder may have more of these disruptions in their school day than they would when they're at home with their family. Treatment for epilepsy is definitely medicine oriented. 70% of children with epilepsy have successful control of their seizures if they take medicine. Of course, these medicines sometimes will have side effects that can cause the child to be lethargic or feel nauseous. The medication might cause fatigue for the child, and so again, you can see why being on these meds is going to affect a child's learning. And also, having seizures, if that happens in school during the day, that's going to disrupt their ability to maybe even stay at school. Maybe the parent would need to come and actually pick up the child and let them rest for the remainder of the day. Well, they're missing all their instruction when that happens. Another one of these, there are many that are listed, and I'm not going to talk about each one of them in the textbook, but I will hit some of them. Diabetes is, I think, the next one that's in the other health impairments category. And of course, this can be something that other kids in the classroom may not necessarily know about their classmate, but teachers definitely need to understand it. Parents are going to be very seriously wanting their child's teacher to understand and watch out for their child who may be either have too much sugar in their system or not enough sugar in their system. And so kids with diabetes is a very serious matter, but they also could be kind of invisible to their classmates in terms of their impairment. And I guess I'm saying, in a way, this could be sort of a good thing because they don't have the same stigma as a child who has something like cerebral palsy. But very, very important that the classroom teacher and other people, like maybe the phys ed teacher, I mean, they all need to know what to do for a child who might, have a diabetic attack and what to do about it, because that can be really dangerous. Asthma is another one of these health impairments. A child might certainly cough or sneeze or wheeze. They will, their airways become obstructed. Again, this can be a life-threatening kind of attack for a child to have at school, and very scary. I've known of children actually who have died having an asthma attack, and their parent is driving them to the hospital. So asthma is a very frightening health impairment for a child to have, for their parent, but also, again, I would say, think about this in a classroom, and a regular classroom teacher is not a special ed teacher. A regular classroom teacher is not a nurse or a doctor, but yet we do have children in our classrooms that we want to have there, but who have pretty serious health impairments. And the regular classroom teacher has to know what to do if there is an emergency with this child's health. Asthma is definitely a chronic lung disease, and the severity of it really varies from child to child, and sometimes kids can grow out of some of the asthma that they might have as a very young infant or toddler or preschooler, but it is the most common lung disease in children. It usually can be controlled, we know this, by medication, but it's important for the classroom teacher to know that stress in a child can bring on an asthma attack. And so children, in addition to knowing how to manage their breathing and knowing when they need their puffer, but they also need to learn how to calm themselves as they become stressed. And so stress training is a new thing that's being done with these children to help them manage their illness and be in public schools. Going on, characteristics of children with these health impairments and physical disabilities. Well, there's a whole huge variance of these children's, the effects and what these kids are like, what their character is like. Some of these kids have actually very short life expectancies, so some of the illnesses that we've talked about or that are described in your textbook, in some cases, these children are not living past their teenage years. That's not a very common occurrence, but it can be. Most of these children who have these disabilities or impairments require some kind of special help. And they might have special equipment that they have to be able to be functioning. And teachers need to be very patient. Their teachers also have to be dedicated and willing to be assistive to these children in the classroom. So somewhere in the text, let me just check the camera, but I'll keep talking. Somewhere in this chapter, there is some discussion about how a teacher has to be able to pick up a child, and it gives very specific instructions about, a way that a teacher might, get behind a child and they need to tell the child ahead of time, I'm coming around to the back of you, now I'm going to put my arms around you. And that's a very interesting discussion in your chapter. I don't think I have the page reference for you, but you should look for that, because there are some very specific instructions for teachers who have to move these children. Part of this is that the child needs to have a warning ahead of time so that they can concentrate on relaxing themselves, so that their tremors or their rigidity, whatever amount of that they can control, that they can go ahead and try to bring some ease into their posture. And I'm sure part of this has to do with keeping the child from getting an injury. But also, I just have to say, I pictured myself in a classroom, having to pick up a 90-pound child. And wow, that's something to think about. And there are safe ways that we can be trained to pick up heavy objects, and certainly heavy children. But this is something that is expected of a regular classroom teacher. And it's important to understand that these children also have a real strong need to be positioned properly in their wheelchair, or to be positioned properly on the ground. Also, some of them need to be moved very carefully and often so that they don't get skin problems like you would get if you were bedridden. So this is a very serious matter, this orthopedic/neurological child who can't ambulate on their own, and who really must be cared for very carefully in the classroom. Let's see, generally as a group, these children do tend to operate at lower than grade level, below grade level. There are, of course, children who might operate at above grade level, and so there are many children who have these physical impairments but have no mental impairment whatsoever, and are sharp little tacks and do very, very well at school. But generally, these children, because of their health routines and their absenteeism and medications that they might be on, do seem to be operating at a lower than grade level status in terms of their academic learning. Secondly, in terms of their social and behavioral functioning, these children can have some problems. They can be lacking in terms of their maturity and how they interact with their peers. I think some of this is definitely probably affected by how much the child is babied at home. If the parent coddles the child and does too much for a child, and I can see how this would happen, how it would be easy for a parent to overcompensate and do too much for a child and not, have them struggle. If that's the case, this child is probably going to behave in a younger manner too, and expect people to do more for them instead of being, having the initiative to do as much for themselves as they can. What else do I want to say about that? This can affect whether they have friendships, whether they're included in parties or invited to sleepovers. And I want you to stop in a minute, and I want you to look at the, I think this is the last video clip that I'm asking you to view. And this is the one coming up. I'll talk about it in a moment. But I just want to emphasize the fact that these children, because they're different, because they look different, because they have assistive devices, they are just, because of the way children are, they're noticeable. And sometimes children can be very kind to them in the classroom. Sometimes children can, their classmates can even overprotect them in the classroom, which isn't good for them. But more to the point, there are going to be always a few kids who are just cruel and who will make fun of a child and, bully a child or tease a child too much, or, push other kids to exclude a child like this from regular play. And that's just sad, I think. But the good, dedicated, humane teacher can have a lot of influence on how the other kids in the classroom view this child with special needs. I'm going to ask you now to stop and look at the video about Jordan, and she's the young woman who has spina bifida. Okay, the cool thing about that clip is that this is a girl who actually is on YouTube typically giving makeup tips, and I love that she is probably not an influencer on YouTube, what do I know, but that is what she normally does with her YouTube videos. But this time she decided to talk about her spina bifida, and she's very frank, as you see. She shows us, you know, her lower spine, her sacrum region, which is really almost where your tailbone is, to give you a visual. I hope you watched this clip because she shows where her spina bifida surgery was done. She talks about having to catheterize herself. She's in her early 20s, and she talks about what that's like. She talks about losing bladder control, that she doesn't have bladder control, that she had to wear pull-ups, I think, as an elementary kid because of lacking bladder control. So this is a really good clip which describes a beautiful kid who has some memories of being bullied and picked on in school because kids noticed that she was wearing pull-ups and having accidents where she's wet her pants at school. And but she does share, I think it's interesting to just hear her talk about it as a 21-year-old, however old she is, because you can really get a sense of how she's learned to manage herself in life and what her life is like. I'm going back to talk a little bit about age of onset for these children. There are a couple of variables that have an effect on how these children function. And one of those is, when do they get this disorder? So the young woman, Jordan, whom you just saw with the spina bifida, she was born with that. She had her surgery on her second day of life. And so kids who have had this impairment, whatever it is, their whole lives, deal with it in a different way than a child who maybe has a spinal cord injury because they were in a car accident. Those are two very different kids with maybe a very similar impairment. So age of onset is a factor for not just the child, but also for the family in terms of how they view this child, what this child's needs are, what they expect and hope for in their child. I think that's a really important thing for us to remember. And then the last piece here has to do with how visible is this child's impairment. So a child who has epilepsy, which is maybe a mild case and also very carefully controlled through medication, their impairment is almost not visible to their peers. And so their self-esteem and their self-image is going to be different than a child who has epilepsy that is very disruptive and who has the very visible seizures. So this affects how kids are affected in terms of how they're, how they're accepted by their peers. Do they have friendships? Are they included? Are they part of a girl group or a boyfriend group? The last two sections, what I want to talk about in this chapter is, what do schools and teachers and therapists do to support these children? Well, wow, these kids have very, very big teams of professionals who are helping them function at their school environment. So they have occupational therapy. They might be receiving speech therapy to help them with not just speech, but the ability to swallow. I don't know if you know this, but kids have to have therapy to be able to swallow, just like people who have had strokes have to have speech therapists come in and teach them swallowing again. Think about that. They have other kinds of therapists. I know I said speech therapy, physical therapy, occupational therapy. So for some children, they need to help with their small muscle coordination. And in the cerebral palsy clip, you'll see children interacting with their therapists, doing different kinds of tasks.